Hi, everyone. Welcome to another episode of Living a Full Life. I'm Dr. Enrico Dolcecore. This week, we're going to be going through subluxations, a word you may or may not have ever heard of. If you've never been to a chiropractor, you probably never heard of it. But if you look it up, there's tons of literature behind subluxations. Let's dive in. Subluxations, unlike dislocations of a joint, which usually require medical attention, all of our joints are encapsulated with ligaments and cartilage to protect its motion, and each joint is designed to move in a specific way, like your finger or your knee or your shoulder. All very dynamic movements in those joints that help move the knee or the shoulder or your arm on your body. They're unique, but once we dislocate these joints, we tear through ligaments, we tear through cartilage, and we tear through even tendon or muscle, which can detach the entire structure, which usually results in a surgical type condition that needs sewing and pins and screws and rehab. Those are serious injuries that lead to dislocations. Subluxations may not be a serious injury that leads to them. They are minor misalignments of joints. You can subluxate your ankle, you can subluxate your knee, you can subluxate your spine, you can subluxate your pelvis. And what this means is that the joints just don't articulate properly anymore for whatever reason. Chronic stress, chronic posture, repetitive motion, whatever it may be, can subluxate joints. What we're specifically going to talk about in this podcast is subluxation of the spine. When we subluxate something like our ankle or our wrist, the nerve flow that goes through it isn't as dynamic as our spinal column. So our spinal cord runs through our spinal column. Our spinal column is made up of hundreds of joints, from the left to the right, superior, inferior to every joint, facets, and everything that's in there translate on one another. And if they get misaligned, we then have a dynamic physical subluxation. So let's dive into these subluxations and what they mean. The spinal column is like a tunnel. If you've ever been to New York and driven through those tunnels in a car, you can see that they maintain a structure and they don't ever move. If they've ever moved or subluxated, we'd have traffic and highway issues all the time. Imagine a boulder falling from the ceiling, interfering with the traffic in the middle of the tunnel. It would back up traffic for days. So just like that, our spinal column is like this information superhighway that runs through this tunnel from our brain to our spinal, to our sacrum, our tailbone. And the spinal cord is about as thick as your pinky finger. So this spinal cord cannot be interfered with. It needs to run fluidly up and down the spine so that it can relay information from the brain to the body and from the body to the brain at fiber optic speeds. They actually translate much faster than any fiber optic cable on Earth. It's an amazing system, but it's designed to not be interfered with. So the primary premise of a subluxation is that it causes some type of interference in that spinal system, in that central nervous system. So the first thing subluxations do is they cause nerve interference. It can be through direct compression because of the misalignment, putting a compression on a minor ancillary nerve or a peripheral nerve, or even a central nerve or a nerve root that comes out of this spinal canal. Our spinal column runs like the main cable of power to your home. It runs through what's called a fuse box in your home. This fuse box has multiple switches in it that direct traffic and direct energy throughout the home and the structure. So we know that this circuit will run to the kitchen and it will supply the dishwasher, the fridge, the stove, and the outlets above the sink. Then we know that the next fuse supplies the master bathroom. So then anything the outlets there, the shower, the toilet, anything that runs on power in the bathroom is going to be run by this fuse. Then the next one is the garage, the next one's the basement, the next one's the master bedroom. And then we know, because circuits can only control and harness so much amps and voltage in each circuit. You can only run so much power through each circuit. Anyways, we're turning this into an electrical podcast. But just like electricity, that is how our nervous system functions as well. So think of your spinal cord as the main cable to the entire system. And then the spinal column, all those joints in your back, the spinal column, the vertebra, are like fuses in your fuse box. So it's like a fuse box. And out the left side and the right side come out identical nerves supplying the left and right side of the body. Some of them supply organs, some of them supply skin, some of them supply muscle function, but these nerve roots are ran on a Merrick chart, knowing exactly where each nerve root goes. We know that L5 supplies the foot's motion. It supplies sensation all the way down the leg, and it supplies a lot of organs like the sexual reproductive organs. We have that all mapped out. We know that the L5 nerve roots do that. The left one does the left leg, the right one does the right leg. Very cool. And then you work your way up, T1, C1. All these ones are mapped out like a fuse box. And that's how I teach my patients how the nervous system actually works and why subluxations can cause nerve interference primarily in these areas of the fuse box of our spine. And we can use technology like x-rays, thermography, motion, palpation. We can do all these things to determine where joints are fixated or not moving properly to address where nerve interference may be. Symptoms are usually a patient's way of telling you where the pain is and where or what might be causing the problems. But as doctors and chiropractors, what we're looking at is to find exactly where the root of the issue is. It could be in the muscular skeletal system. It could be in the spinal system. It could be anywhere along those lines. And nerve compression can happen in multiple different ways. Okay, this alters nerve signals, ultimately causing a distortion in function, some way, shape, or form. Pain isn't always the culprit, but sometimes the distortion in nerve flow can cause weakness, or it can cause numbness, or it can cause tingling, or it can cause a weird sensation or burning. Sometimes there may not be any symptoms because the nerve root that's being compromised is actually supplied to organs. Maybe the parathyroid or the thyroid gland is those nerves in the neck are being interfered with, and our thyroid isn't functioning properly. And then you start to ask the patient and dive deeper into some questions. And you ask something like, how are your allergies or how are your headaches? And they like, oh man, I get headaches. But I get the normal amount of headaches. I love that when patients tell me that. And I'll be like, hey, Nancy, what's the normal amount of headaches? I haven't had a headache in 7 years. What's normal for you? I guess my normal headache is 1 in 7 years. What's your normal? And they're like, oh, every other day. I'm like, okay, that's not normal. There's something going on. How long has that happened? And then you end up digging up this whole story of, wow, all these issues kind of started at the same time. The weight gain, the neck pain, the headaches all kind of started around the same time. It started with headaches, then it turned into neck pain. The neck pain kind of got mitigated with maybe some ibuprofen. And then the weight gain started. And then we send them for blood work and their thyroid is not working properly. Then we start adjusting them and then their thyroid starts to work properly. And then they start to lose weight and they're like, wow, adjustments make you lose weight. I'm like, no, they don't. They made your body function better. Your thyroid started to function better. And because of that, your metabolism functioned better. So that's just one simple story of how altered nerve signals can lead to pathology. Or in chiropractic, we like to hyphenate the word dis-ease, D-I-S hyphen EASE, disease is the root word that we use for altered or impaired function of the natural's body's functions. So that's interesting there. But now if we look at this as a physical thing of like, okay, there's distortion of the spine, there's misalignment of the spine leading to subluxation, it causes nerve interference. What else can those misalignments do? Well, they can alter blood flow. They can alter cerebral spinal fluid flow. They can alter lymphatic flow. They can alter a lot of other things. So impaired blood flow reduces oxygen and nutrient supply, both to the area where it's being restricted. So tissues, that's where we get like neck stiffness, neck pain, or tender muscles around our neck or traps. And they're always tender or they're super tight all the time. You feel them, they're super tight. Patients say that like, feel this, doc, doesn't that feel tight? Yeah, it's because of restricted blood flow. And that can lead to chronic inflammation. It can lead to other things. So tissues and organs may not receive adequate oxygen. They may not get the right nutrients, leading to impaired function and a potential disease of that tissue as well. It could also lead to stagnation. So if we don't have proper flow, we can have fluids that stagnate for too long. This is called like edema, where a fluid pools up. Poor blood flow can contribute to inflammation of the area. Metabolic waste products stay there and they always feel tender or tight. That's lactic acid buildup. And this can exacerbate health problems as well. So now we start to think on a bigger thing. Well, alignment plays such a huge role in the normal flow of the human body. That's why we're supposed to stay aligned. So I've seen people with horrible scoliosis. I take an x-ray and they just look absolutely horrible. But overall, their health is actually quite good. That happens sometimes. And you say, well, why? Isn't that a massively misaligned spine? And the answer is no. It's actually a very well-aligned spine in a very unique position where everything is aligned. The spinal cord is actually unimpinged. There's no interference in it. And obviously the nervous system's working optimally. So you kind of leave that alone. You just try and help the patient with the muscle conditions that come with it. You can have a tight right side and a weak left side, and scoliosis can lead to other things. But it just goes to show you how bad something looks may not be as bad as you think. And as good as something looks, it may not be as good as it looks too. Just had a physical. I do my annual physical with my medical doctor every year, and I just had it this morning, and she had a great insight on that. I'm like, Doc, it's kind of frustrating with the weight. I'm the exact same. She's like, man, you lost 1 pound. I'm like, yeah, from last year. She's like, yeah. And she's like, I hate BMI because it doesn't tell us anything about anything. She's like, your blood pressure is good, your blood work's good, everything's good. The weight stays the exact same. I told her, listen, I've gained 12 pounds of lean muscle mass since I saw you last. And she's like, wow, that's amazing. You do look different. She's like, you look leaner, you look healthy, everything looks good. She's like, isn't that amazing that you could put on 12 pounds of lean muscle mass, which obviously means you lost 13 pounds of fat off your body. I'm like, yeah, I guess that's how it works, isn't it? And we started talking about that. She's like, yeah, that's why I hate BMI, is because you'll get someone in the 19 BMI range who's on paper looks fantastic, but the only reason they're there is because they don't eat any food, they smoke, and they're actually not healthy at all. Their blood work's horrible, but they maintain a good BMI. So BMI doesn't really tell us much about overall health. Same thing when we talk about the spinal system, is it has to actually be functioning well before we actually know if it is functioning well. Because some of the symptoms, we may not get symptoms. We may not feel the things of a distressed nervous system. And that's where getting checked for subluxation, just like getting checked for your wellness exam every year, is a crucial part to a healthy lifestyle, because an uninterfered nervous system is the definition of wellness. That is how you live a well life. So that's where we kind of harp on there. Subluxations can also alter biomechanics and stress. So they can alter how we move. It can lead to muscle imbalance and tension, joint stress, and degeneration. A misaligned joint that's misaligned for too long puts a lot of stress on the disc and the facet joints of that vertebra above and below. And over time, if we stay in that distressed position, those joints start to decay a lot faster than they should. So we're seeing stage 3 spinal degeneration in people in their 30s and 40s because they've been stuck or have worn away those joints at a faster rate than people in their 50s and 60s. So I've seen degeneration as young as 30s all the way up to healthy spines in their 70s and 80s. So this all is about maintaining a proper alignment of the spine and reducing and removing subluxations regularly to maintain proper function of the nervous system. With the amount of work we do on our skin, on our aesthetics, and the way we look, our hair, our skin, our body, our weight loss, everything that we see in the mirror, the amount of tension that the amount of focus we put on this, if that just partially or fractionally was put on the interior of our system, of our nervous system, and we had attention of our nervous system, we would be so much healthier as a society. The coolest thing about chiropractic in the last 10 years is it's doubled in utilization in America. People are now leaning towards chiropractic and understanding the underlying premise of, holy smokes, if I align better, I function better. And that's the point of this podcast, is to reach more people to understand that getting adjusted is no longer what your grandparents used to think of chiropractic and how it's quackery and it doesn't work. And how can an adjustment of a spine remove a disease? It's not the connection we're trying to make. We're saying as chiropractors for 135 years, we've been doing the exact same thing to everybody, adjusting them by hand. That's what chiropractic means, by hand, practiced by hand. And it hasn't changed because it works. It's worked for over 100 years and it continues to work, and it hasn't changed at all, because why change something that works so well? And that's why it hasn't changed. So I encourage you, if you're listening to this, to test out chiropractic care. It's a phenomenal healthcare modality that should be in your back pocket for the rest of your life. Another thing subluxations do is impact on the autonomic nervous system, which we talked about this. And we talk about physical pain and muscle pain, but what about impaired organ function? Dysregulation of autonomic functions can affect organs and systems, potentially contributing to a wide range of diseases. This is right from Guidance Physiology. Weakened immune systems Disruption in nerve communication can impair immune system responses, making the body more susceptible to infections and illnesses. And then systemic effects as well. Subluxations can lead to chronic pain, reduced mobility, and inflammation and swelling in certain areas. That is the most common reason people seek out chiropractic care. It's an amazing modality. I've been true and testament my entire career to this. But subluxation, I think, is the root cause of all disease, virtually all disease. You can never say all or never, I guess, in our lifetime, but virtually the root cause of all disease. If we have an impaired nervous system, and that is impaired for long durations of time, decades, it leads to decay of wherever the decay may be. If we have chronic low back issues, we may have chronic gut and abdominal and those organ type issues. If we have chronic neck issues and decay there, we may have, thyroid and brain issues from there as well. So thoracic issues, we may have long-term thoracic issues, thoracocardio issues, lung issues, breathing issues, O2 issues. So because it's mapped out just like the fuse box in your home, in your basement or in your garage, wherever your electrical fuse box is, same thing with the spinal cord. It's an amazing, intricate system that you should take very delicate care of through specific and gentle and effective chiropractic care. The growth just shows me that people are getting it, people are referring, people are telling their families to go to it, and that chiropractors are doing such a great job building the community in America doing this and doing such a great job delivering great chiropractic care. So I think we used to be weary and watch over where the referrals would go to. I think you going online, finding a local chiropractor is probably the best thing you can do and going to be safe and effective because we've been successful because of the good work we've done. And most chiropractors are really great at what they do. So continue on with all your care. Have a great week and stay well.